Topic: Handling of Corrective and Preventive Actions, CAPA. Standard Operating Procedure. Objective of Subject. The objective of this Standard Operating Procedure, SOP, is to establish a procedure to analyze processes to identify existing and potential causes of non-conformances and initiate effective corrective and/or preventive records. Scope of theme. This SOP is applicable to all departmental and site based on this SOP, ensuring all requirements in this SOP put into the site SOP. Site-specific SOP shall not ignore any point/understanding/workflow given in this SOP. This SOP applies to out of specification, OOS, out of trend, OOT, product quality complaint, customer audit observation, internal audit observation, regulatory audit observation, global action, product recall, deviation, product quality review, management review, risk assessment, investigation, regulatory agency inspection database, RAID, trend and others if applicable. Responsibility of persons. Functional supervisor, initiator. Initiates Capa record based on the investigation finding, issue. Uploads the document files to Cqms after restoration and submits the original documents to QA, documentation for archival. Quality assurance, QA. Reviews and evaluates initiated Capa record for completeness and adequacy. Informs Capa owner if Capa effectiveness check has failed or is not satisfactory. Verifies the effectiveness of corrective, preventive action. Archival of hard copies and backup supports wherever applicable. Reviews Capa record, including timelines, root causes, proposed corrective actions and verification of effectiveness criteria. Quality Review Board members. Participates in all QRB meetings, no delegates. Identifies and assigns Capa owner for implementation. Review and approval for extension of Capa. Sets meeting schedule and agenda. Drives variety of decisions on Capas such as determines adequacy of scope, proposed corrective and preventive action plan. Invites subject matter experts, SME, from other functions to provide relevant information during the meetings. In cases where a Capa record must be initiated immediately, QRB Chair is authorized to coordinate with the SME and assign him, her as Capa owner to implement the Capa. These decisions shall be ratified at the next QRB meeting. The QRB Chair approves the meeting minutes after incorporating input from permanent members. Department Heads. Provides resources to implement corrective, preventive actions. Participate in QRB meeting as required. Capa owner, responsible person. Implements corrective, preventive actions to address root causes. If needed, conducts broader investigation as per procedure on investigations to identify potential root causes of quality issue. Proposes verification of effectiveness plan. Initiates change control as needed. Collects and provides data to QA to verify Capa effectiveness for adequate closure of Capa. Site plant head. Review of Capa extension request. Some important abbreviations and definitions. Cqms, Capa Quality Management System, a software for management of quality management system elements like Capa, OAS, deviations, OET, etc. GQS, Global Quality Standard. QA, Quality Assurance. QRB Chair, Site QA Head acts as the QRB Chair. Quality Review Board, QRB, cross-functional oversight board that includes permanent members such as QA Head, Chair, Site Head, Manager Validation, Manager Regulatory and Manager QA. Representatives from other functions may be invited, as required, by the QRB Chair. Subject Matter Expert, SME, an individual who is educated, trained, and experienced in a particular field or subject matter. Responsible person, Capa owner, an individual who is responsible for execution of Capa and/or is SME having knowledge to execute and close the Capa. Some important abbreviations and definitions. Corrective action, CA, action taken to eliminate the causes of an existing nonconformity, defect or other undesirable situation, in order to prevent recurrence. Preventive action, PA, action taken to eliminate the cause of a potential nonconformity, defect or other undesirable situation, in order to prevent occurrence. Effectiveness criteria, measurable standards that, if met, demonstrate a corrective action has prevented recurrence of a finding, issue and/or a preventive action has prevented a potential finding, issue before it occur. Procedure. General instruction, a validated electronic system, manually in Excel password-protected soft copy shall be used for implementation of Capa procedure. A paper-based system as a part of business continuity plan shall be applicable for management of Capa. Procedure. A Capa record shall be initiated as an outcome of out-of-specification, OOS, out-of-trend, OOT, product quality complaint, customer audit observation, internal audit observation, regulatory audit observation, global action, product recall, deviation, product quality review, management review, risk assessment, investigation, regulatory agency inspection database, RAID, trend and others if applicable. Cqms Capa workflow : Initiation of a Capa can also be done based on management review at site or at corporate or based on analysis of quality data trends. All commitments of audit observations requiring action plan with timelines for critical, major or minor deficiencies shall be routed through the Capa system in the Cqms. Capa shall be initiated by the functional supervisor or quality assurance. Capa Initiation. The initiator shall initiate Capa's records for each set of corrective actions and preventive actions respectively, and each Capa initiated shall be identifiable with a unique identification number. Following information shall be provided for Capa as applicable: department/thing/block/area name etc. Short description of Capa. Capa priority, based on SOP on risk management as applicable. Justification and Capa due date. Root cause category and a summary of root cause. Attach all data and files needed to support the source of Capa. The initiator shall submit the duly filled Capa record to QA for review and evaluation, and QA may return the Capa record back to the initiator, if additional information is required, and upon satisfactory review of the Capa record details, QA shall submit the Capa record to QRB chair. Implementation of corrective, preventive action. The Capa owner shall define the effectiveness criteria and effectiveness monitoring period. The Capa owner shall perform an impact assessment to assess the impact on the activities that are to be carried out until the implementation of the Capa and build adequate controls during the interim period of Capa implementation. The functional supervisor/department head of Capa owner shall ensure that adequate resources are provided to implement corrective, preventive action. The Capa owner shall review and documents the activity implementation and report evidence that the corrective, preventive actions were effective along with the date of Capa implementation. During implementation, if the Capa is needed to be discontinued for any scientifically justifiable reason, for example discontinuation of product, closure of facility, area, unit, the Capa owner may send a discontinuation request with justification to QA. The Capa shall be discontinued and closed if it is found to be justified, else it shall be returned to Capa owner for implementation. Capas shall be effectively tracked for closure within the due date. Implementation of corrective, preventive action. The Capa owner may also seek an extension of the Capa closure due date and shall request the QRB chair for extension of the closure due date by providing the justification, along with an interim report signed by the head of the department, to indicate the status of ongoing Activities. Kappa owner shall carry out impact assessment to assess the delay in Kappa implementation and shall document it accordingly. The extension request and interim report for Kappa shall be reviewed by site plant head, for manufacturing related, site QA head, for quality related, or designee. The Kappa owner shall record, attach the decisions/recommendations agreed to in QRB as justification and submit to QA for further action. Kappa effectiveness verification and closure. Post-implementation of Kappa, QA shall verify effectiveness of Kappa. Based on the effectiveness criteria determined earlier, QA shall write the summary of effectiveness verification in field of effectiveness check in Cqms. If the Kappa implementation is found to be satisfactory based on the set effectiveness criteria, Kappa shall be closed. Initiator shall submit hard copies of documents wherever applicable, to QA for further archival. If the Kappa implementation is found to be ineffective, QA shall return Kappa to the Kappa owner, responsible person, for further actions with review comments summary. The QRB shall oversee the effective and timely implementation of the Kappa. QRB coordinator shall compile Kappa trends and analyze for further improvements if any. Consider other facilities, lots and products, within its purview, which may also have been affected while reviewing the Kappas. Evaluation by regional quality assurance. The Kappa signals triggered from management reviews which are identified as probable regional or global actions shall be communicated to the respective regional quality assurance, site quality assurance and adequately tracked for implementation. Cqms procedure for Kappa management. The Cqms workflow for Kappa management includes: a sequential identification number is auto-generated by the Cqms system for the Kappa record. Predefined templates are available in Cqms for generating various reports, which can be auto-generated by the system after fetching data from the relevant fields. Reminder notification of Kappa due date is generated before 10 days and from then, reminder is set every day and extended to QA who has performed review on that Kappa. Cqms demands for mandatory justification for delay in closure beyond due date, if due date extension was not requested and approved. Detailed procedure for handling Kappa in Cqms may be referred from the Computer-Based Training (CBT) manual. Preservation of records, if applicable. Guidance / examples on Kappa effectiveness criteria. Effectiveness criteria, measurable standards that, if met, demonstrate a corrective action has prevented recurrence of a finding, issued or a preventive action has prevented a potential finding, issued before it occur. This is a criteria to evaluate whether the implemented action is really capable and effective to prevent the recurrence of non-conformance, and this must be proved by the data or documented evidence. Hence, a effectiveness criteria must be SMART, specific, measurable, achievable, realistic, and time-bound. Person selecting time frame for effectiveness criteria shall evaluate whether activities being performed are on daily basis or in a fixed frequency or is dependent on manufacturing plan, etc. Effectiveness criteria shall be selected based on 1. Manufacturing and testing plan. 2. Availability of input materials. 3. Resource availability. 4. Detailed plan for activities in time frame manner. 5. Consensus, agreement amongst stakeholders activities to be carried out. 6. Clarity on activities to be performed either by individuals or group. 7. Setting of target date for completion and effectiveness verification shall be based on dynamic realistic plan. Few Kappa effectiveness criteria examples but not limited to. This is for guidance purpose only, however case-to-case evaluation shall be carried out with respect to root cause and Kappa. Where appropriate, approved instruction shall be followed for monitoring, evaluation of effectiveness criteria. Monitor next-X batches, products manufactured to demonstrate effectiveness of implemented Kappa. Monitoring of X batches supply from vendor after implementation of Capa for X days, months. Verification of SOP execution by observing, monitoring for specified time period. Performance evaluation of X operators, Y from each shift, randomly selected. Monitoring of analysis for X batches after revision of specification, SDP. Monitoring of instrument working for X days, months. Monitoring of repeat failure, deviation of similar nature for X days, months. Effectiveness checks of personnel training for procedural non-compliance by monitoring activities executed by individual for period of X days, months or evaluating for improved skill, knowledge through questionnaire. Few Capa effectiveness criteria examples but not limited to. Effectiveness check of procedural inadequacy by monitoring activities executed. WRT revised procedure for inclusion of instructions for X days, months. Verification of enhancement in the software system by reviewing, monitoring activities executed after implementation of Capa for X days, months. Effectiveness of Capa can be exhibited by either removal of cause or providing better control, better detectability or improvement in performance. Example, increase in % yield, low rejection rate, improved assay, content uniformity, improved % dissolution, with respect to previous trend. Effectiveness of Capa for process or quality to exhibit consistent deliverables over a period depending upon the product quality specification and frequency of manufacturing. Keep on happy learning. Thank you. Thanks for watching, liking, subscribing and bell icon for my channel. AIM Knowledge Mantra.